Hello, I'm going to talk to you about 5 hidden dangers of women for breast cancer. This is Dr. Mrs. Ramesh Saren, Senior Consultant Surgical Oncology, specializing in breast for the last 40 years at the Indraprastha Apollo Hospital, New Delhi. The 5 hidden dangers or the 5 hidden facts are that mammography can miss breast cancer in about 15 to 20% of the patients, but this is the only screening modality that has shown the world over to reduce mortality, and you should go for a regular mammograms, especially after the age of 50 once a year and after the age of 40 if you have a family history. The second hidden danger is that breast self-examination, though practiced and is being advocated, does not reduce the mortality, but it's a good method to be aware of your breast health. The third hidden danger is that you can get breast cancer if there is a family history in the mother or grandmother or great-grandmother or in your mother's sisters. So please let the doctor know if there is a family history so that appropriate tests can be carried. Fourth hidden danger is that obesity and inactivity and no exercises can lead to a higher incidence of breast cancer. And the fifth hidden danger is that follow-up after your breast cancer treatment is mandatory to see if there is any loco-regional recurrence or any recurrence anywhere else in the body. So please be aware of these 5 hidden dangers that most women do not know. Thank you so much.